In the weeks since George Floyd was killed by a Minneapolis police officer, thousands across the U.S. have protested the country's failure to stop police killings of Black people, as well as the deeply entrenched systemic racism that these deaths are just one symptom of. Even with the ongoing COVID-19 pandemic, many medical experts support these protests due to the fact that racism itself is a public health crisis, a chronic one that has been causing deep health disparities for Black communities long before the pandemic began. However, with any large gatherings, experts do also worry that these protests could increase coronavirus spread. So what can you do to protect yourself and your loved ones from COVID-19 if you're participating in the protests? You probably already know to follow social distancing guidelines, such as wearing a mask while you're attending, but we also recommend diligently checking for symptoms after the protest, and if showing signs of COVID-19, getting tested for coronavirus. If you start to show symptoms, please do get tested. Once you learn your result, if it's positive, you should minimize the risk of infecting others by self-quarantining for at least 14 days and avoiding any additional protests until you've been cleared by a healthcare professional. We also encourage you to tell the people you attended the protest with so that they too can take the appropriate precautions. If you test negative, some experts still recommend self-isolating for 14 days to be safe and to lower the risk of spreading the virus as much as possible. If you do need to get tested, you can find a testing location near you by checking your local health department's website. A number of cities and states are now offering free COVID-19 tests to protesters so that these important demonstrations can continue as safely as possible.